Hey everyone, Cindy Yu here, National Welfare Manager at Outside the Locker Room. Welcome to episode 16 of the Expert League, where I interview different experts each month. And today's Expert League is based around National Psychology Week. And in its 18th year this year, Psychology Week is promoting the role of psychology in helping people with pain. So today I'm going to be speaking to not one, but two experts in the field all the way from WA. First, we have Dr. Rob Schutze, who's the founder of Wisdom Health, who is a clinical psychologist specialising in chronic or persistent pain. And Rob is a research academic and adjunct lecturer at Curtin University, where he is involved in various research projects. And he works closely with many GPs, pain medicines, physicians, and physiotherapists, such as Professor Peter O'Sullivan, who will be also joining us today. Peter is a specialist musculoskeletal physiotherapist as awarded by the Australian College of Physiotherapists, and he's also a professor of musculoskeletal physiotherapy at Curtin University. He's internationally recognised as a leading clinician, researcher and educator in the field, and he's also the clinical director of Body Logic, where he reviews patients with complex musculoskeletal pain disorders. So I'm absolutely thrilled to be speaking to two renowned leaders in the field today, and I really hope you enjoy this interview. Rob and Peter, thank you so much for joining me here today. I'm really excited to be having a conversation around chronic pain and injury management, and not only from a physical perspective, but also a psychological perspective as well, in light of National Psychology Week. So firstly, I'd love to find out your perspective on what is pain from a psychological perspective.
Yeah, well, I guess pain's a whole person experience, and so the psychological and the physical are deeply intertwined. And I think we often see pain as a physical event in the body, but it's important to see that it has these different dimensions, and the physiology of perceiving pain involves this complex interaction between tissues in the body and the brain and the central nervous system. I guess the sort of gold standard jargon definition is that pain is an unpleasant sensory and emotional experience associated with or resembling that associated with tissue damage, real or potential tissue damage. So that's the sort of a mouthful, but there's a few components there, and I think one of them is that it's unpleasant, and that's what we all know, is that pain doesn't feel good, it's sore, and we try to get away from it. But also that it's got these sensory components that are about the body, sort of where it's pointing to in the body, but it's an unpleasant emotional experience as well. And that's where people often, I guess, can find themselves suffering in silence a bit because they feel, I guess, a bit bad or shameful for struggling with pain and feeling anxious about it or feeling a bit low or hopeless. But we know that actually a lot of these, I guess, psychological, mental health aspects of pain are just part of the normal psychology of pain.
You know, I think just to add to that too, pain in sport is particularly interesting because a lot of sport does involve pain. If you're in a contact sport, that involves quite a lot of pain. If you're involved in endurance sport, that involves pain. And that pain's got a different meaning because it's a part of an accepted part of sport is that, you know, you go through a pain barrier. And so that kind of pain's got a different meaning to pain that's associated with potential injury or injury, where it's got a much different threat. So I think what we know about pain is when it's predictable, and we understand it and we can control it, it doesn't have the same kind of impact emotionally on people than when the pain is not controllable or unpredictable or more threatening. So we would see an athlete who might experience really high levels of pain, which doesn't bother them at all because it's pain associated with the sport that they know is linked to competing and building capacity around a sport. But they might have another kind of pain that is really distressing, that is really worrying because it's a pain that becomes a threat for them engaging in that sport. But the level of the pain might be exactly the same, or it might be that the pain that's threatening is actually at a lower level, but it's got a way more emotional kind of threat attached to it. So pain is really interesting in the sense that it's all about meaning and what we associate it with that meaning as well.
Yeah, so that level of understanding or level of the context can really trigger a higher level of distress, regardless of if the pain is the same level or not. So
Absolutely.
when we have a sporting environment, I guess we can see the pain. We usually know what it's caused by. We usually have some directions in terms of how to manage it. And given most of our audiences are sporting athletes, many of them would have struggled with injuries before. So what sort of effects do you see when you're working with these individuals on the injuries and the pain?
So I think one of the things that we would separate is pain related to sport and injury. So we know that a lot of people who engage in physical activity have pain. And as I said, it's kind of separating out what is pain related to injury and what's not. So pain related to an injury might be something like an ACL rupture, a fracture, stress fracture. That's linked to some kind of trauma where the forces that are exposed to the body exceed the tissue tolerance. Mm-hmm. So you've got demonstrable injury that you could do a scan and go, yeah, that tendon or muscle or whatever is injured. The thing that's really interesting around this, there was a study done looking at muscle injury and looking at how much damage was done to the muscle and how much pain a person feels, and they don't correlate. So you could have a really minor tissue injury with heaps of pain or a major injury with very little pain. So what we do know is that how injured you are, how injured the tissue is not that well represented by how much you feel. How much you feel is much more predicted by your perception of threat around that injury or how you feel, how you cope with that injury. And so there's this really interesting interplay between, what is injury and how you respond. And the other thing that's important to note is that a lot of pain in sport is not linked to injury. That pain often, we know this, often emerges at a time when you're tired, you run down, you're stressed, where your whole immune system is a bit flat and your system becomes more sensitive at that time. That could be manifest in pain.
So one of the things we're often trying to help people to discover is that there's not this strong relationship between injury and pain, that hurt doesn't equal harm, and so that you can have pain, especially when it goes on for a while and it's kind of been hanging around, and especially say longer than 3 months where most tissues would have healed themselves. That doesn't mean that you're still injured. It's often because your whole nervous system has adapted and changed, because we know that they like to do that, which is a great feature. Neuroplasticity is a great feature of our systems, but sometimes it's not so helpful when it means that we get better at doing the job of pain.
Yeah.
There was a really interesting study that was published just this year that looked at people engaging in physical activity, and when the person engaged in physical activity and they perceived it as threatening, their nervous system became more sensitive. Mm-hmm. When people engaged in physical activity and it wasn't threatening, it became less sensitive. And so our nervous systems are there to protect us. And if we're engaging in a physical activity and we think we might be harming ourselves, our nervous system will go on to protect us by making that region more sensitive. So there's this really amazing interplay between our thoughts and our emotions and how our nervous system responds to the threat of pain. And that can kind of dampen it down or could wind it up. And so as healthcare practitioners, we have a really important job to give a real understanding of the meaning of the pain, but also give people strategies or equip them with positive strategies to deal with it.
Absolutely. I really like the way that you've distinguished injury versus pain and the actual physical damage that's caused versus how we actually feel that pain. I think that's really great distinguishment. And so it sounds like we can treat these injuries both physically and psychologically. So do you have an advice on how we can treat or manage this pain, maybe in a psychological sense?
Yeah, I guess the key here is that it's not one or the other. Just like we can't say pain is a physical or a psychological experience, treatment has to be integrated and multidisciplinary or interdisciplinary. We know that there's good evidence that, say, physio alone or psychology alone can reliably help people with, say, persistent pain. but it's pretty modest, the effects. They're pretty small effects, but we get much better effects when we're working together. So I guess the key here from a psychological perspective is to work in with, say Pete and I working together to go, well, how can we optimize the physical function of what the structures and the tissues are doing and load them in a way that's not so provocative, but also try to help someone feel positive about the way they're engaging with their bodies, how they're feeling embodied, feeling confident, thinking in helpful ways, engaging in valued activities. So it's really got to be a combined approach.
And I think in line with what Rob's saying, one of the things that we see within the physiotherapy world is that we've really shifted away from, or there's a growing shift away from just looking at the structure and the function to go, this is about a human being, and it's about how their beliefs around their body, their perception of their body, their ability to control their body and engage with the things that they love. And so there's growing evidence that for someone who's become disabled by pain or where it's become chronic, as Rob said, the nature of the injury part is really diminished in that sense. And it's really much more around a person's understanding of their pain and their ability to cope with their pain and then engage with normalizing the way their body works. Because what we know is that when a person has pain, the nervous system goes into protect it. And so usually around the painful area, we overprotect, we overtense. And so, for example, in back pain, we know that people with back pain overguard and protect their back. So they put more stress on the painful structure, which means that when they engage with physical activity, they actually set themselves up for more pain. And so the whole system becomes a loop where there may be negative thoughts. It's like, I need to protect my damaged back, creates worry, which then creates this protective response. And part of our job is to kind of dismantle that process to say, actually, this is not about a damaged back. It's about a sensitive back, that you can build trust back into those structures, because actually backs love to move normally and engage with activity. And if we grade you back up in a graduated way to engage with the things that you love, it kind of dismantles the whole fear and protective responses around the body. And what we find is that when people get really stuck in that process, working with psychology to kind of help support that process is really important.
I really admire this holistic view of the individual. It's not just the injury, it's not just about seeing a physio, but it's also about tackling the psychological aspects and the perception of that injury and the pain. That's really, really important. So it sounds like you guys really work really well together. It sounds like a really great team that you have there. And in terms of talking about pain and, different athletes responding to pain differently, and we've heard about some of the whys, is there a time where pain could be useful for athletes or for individuals?
That's a great question, and I've thought about that a little bit. I think, it comes down to the meaning. So, for example, if an athlete is overtraining and they develop a stress fracture, that is a sign of the body to say you need to back down. You need to kind of back off a little bit. If pain is emerging at a time when the person's under heaps of stress, their mental health might be compromised, they're not sleeping well, then that's a sign that they need to really care for their mental health and for their whole health to mitigate that. So pain's got different meanings for different people, and I think the key thing is to understand for that individual what pain means. So in some senses, it may mean that the person needs to build their confidence, and other times it may mean they need to care for their physical and general health more. Other times it may mean they need to just back off a little bit in terms of the amount of training, because they've just ramped it up way too quickly. So pain can be a great a way in which, if we interpret it accurately, it can teach us a lot about how to care for our health.
And so I guess often in that sort of short term, we call it acute phase, pain's a bit more reliable as a kind of, a flag that maybe we should check out what's going on in the body. But once it's gone on for quite a long time, it becomes less reliable and it's not as helpful. And I think that's one of the areas we often get stuck in with kind of trying to help people recover, is that the goal is to get rid of the pain. And actually, we need to focus on improving function first, so kind of getting back into living. And there's probably often still going to be some pain hanging around because it takes a bit of time to kind of calm that nervous system down and restore its normal functioning. And so the goal is more living life, and then the pain starts to take care of itself rather than the other way around. We often see people going, well, I'll just start living my life once I get rid of the pain. And you get really stuck in a vicious cycle then of worry, and you're hyper vigilant to the pain. You're thinking, is it gone yet? Is it gone yet? And so all of that attention actually is another part of the protective mechanism that keeps it going and keeps it all wound up. So yeah, it's kind of understanding the best pathway forwards to get to your goals.
And I think what you tap into there, Rob, is how in sport, probably in sport, we see the most over-treated people. Very often in sport, if someone has pain, they go quickly for a scan. They often get a lot of, hands-on treatment or invasive treatment. But in actual fact, we know the best kind of long-term therapies for pain are the things putting the athlete back in charge of their health. Instead of going for passive treatments and getting treatment to the body, it's actually putting them in charge to say, actually, what can we help you to do to care for your health so that you develop autonomy over it? And I think we've got this kind of health system which is really good at it becomes very pain focused, but not person focused, where this attention is to try and fix the pain. And when pain is persistent for a long period of time, it's very, very hard to fix. And that becomes something that can be a really unhelpful kind of process where people go through, and we've seen it with multiple surgeries, and it's not fixed, and it just escalates the person's distress.
And probably also in sport, if you're thinking about your viewers, a lot of the time what's happening is that sport is part of your whole social world, your identity. It's where people often get their connections, their sense of fun. It's where they exercise. It might be where they develop other skills like learning to fundraise and stuff like that. So being injured or having pain and not being able to play a game, a footy say, becomes hugely threatening. Or people and if people stop engaging and kind of get into a bit of a black and white way of thinking about it, if I can't train properly or if I can't play, I just won't go. Then it has all these other kind of effects this sense of loss. And we know that loss of social connection and enjoyment, valued activity is part of the sensitizing process that keeps pain going. So I guess one of the other things we're trying to help people do is stay engaged in those contexts, those systems that give them meaning, whether it's work or sporting club. So still go and participate, still go to training, help out with what you can, bit of a light jog, or do what's feasible for you that's not too provocative, but so that you're still getting all of those other benefits.
I think just in tapping in with that as well, we see a lot of people, like athletes who develop pain, who think that pain, engaging with movement and activity is going to be damaging for their body. In actual fact, what we know is even after an injury, so like, for example, if you've sprained an ankle or you've torn a muscle, early engagement with movement and activity and loading is the fastest way to recovery. And there's a lot of evidence now supporting this idea that you rest and avoid movement and activity as a way of getting better is actually not the fastest way to recovery. That movement and activity and loading is the way that tissue builds health back. And that as long as it's graded in the right way and coached in the right way, it is the key for the fastest transition back to activity. And it's a key preventer for chronicity as well. And so getting the right messages early and the right coaching early is so important for preventing kind of long-term disability.
Yeah, really, really important points that you've made there, that injury can feel quite threatening to an athlete. And it sounds like that it's actually a great window of opportunity for them to learn about themselves, learn about their limits, and build up their confidence levels and really look at it in a holistic way. But it sounds also that early intervention and working with the right professionals is one of the best ways to recover quickly as well.
Yeah, and that idea that it can be a great learning opportunity is something that we often try to tap into. I mean, all the people I've worked with who have had this horrible, debilitating experience, often for years, of pain that's led to lots of losses and functional impairment. When they start to feel empowered and learn skills to self-manage, it's often a really beneficial part of their self-development, and people often reflect on how that's been not something they would have chosen, but having had it, they've grown as a person. They've become more patient, more compassionate. They've understood themselves better. They've developed skills in learning how to manage their stress levels, to get better sleep, to steer their life in a direction that's more in line with actually what makes them tick, with their values. So it's often, we don't want to overplay the silver lining with people and go, hey, this is a great opportunity. But people often do discover that for themselves, and the opportunity is there.
Well, thank you so much. It's been such an incredible conversation we've had so far. I could literally be speaking to you both for hours. I think you're doing really incredible work. I guess final question is, how do individuals get help for their pain? Can they reach out to you both or your clinics? Like, what's the best way to get help for their pain?
So we have quite a lot of information online. So we've been running and supporting a podcast called Empowered Beyond Pain, and it's really designed to empower people in the broader community to understand pain better and learn to manage it better. There's some wonderful websites as well. Pain Health is a website that both Rob and I have contributed to, which is a health department supported website. Helen Slater, who works with us here, was one of the key drivers of that website. And there's some really great resources on that website to help people understand pain better. There are some wonderful blogs, like the British Journal of Sports Medicine supports a whole bunch of podcasts and blogs, which are about evidence-based information around sport and pain. And I think that's a really cool resource as well. We are also involved in social media, so I'm present on the likes of Twitter. So that's another source of information. We can also be contacted through our website, through Curtin University website, or Rob's practice, Wisdom Health, or myself at Body Logic Physiotherapy.
I think the other thing is also just to let people know that they've got to find the right clinicians that have a good fit with them. So treatment seeking is often tricky, and people often have some negative experiences. In fact, often, some of those protective responses and stuff we're talking about are driven by things health practitioners have told them in the past, and it can be quite disempowering. So I guess my suggestion as well is, when you're going out and looking for a physio or a psych or whatever it is, you be the barometer of whether they're well qualified for you. It's good to ask, have they had some experience working with, and are they interested in working with people who've got persistent pain, and get a sense of what that's been about. So with physios, there's actually like a pain physio titling, and the same thing doesn't exist, unfortunately, with psychology, but I guess there's a bit of more emerging interest in that field, and hopefully we'll get some way to credential people so you can go to a website and search for people who've got some of those skills. But I guess the key is that you come away from that encounter with the health professional feeling empowered, feeling listened to and validated. And if you're not, I'd probably keep shopping around. Yeah,
I think it's really important what Rob highlights. One of the things that we would strongly encourage, like, we know best care for pain is about providing people with knowledge, strategies, skills, a plan that puts them in charge. And if they're not getting that, go elsewhere very quickly.
Yeah, absolutely. I love the concept of having the individual in the driver's seat. They make the decisions for themselves,
Exactly,
what's right for them, and really empowering them with knowledge and resources. And thank you for sharing all of the resources that you have, and for all the research that you're doing in the field as well. I think it's going to really take us to the next level. So I really appreciate your time with me today, and best of luck for your future studies and research.
Thanks for the opportunity.
Thanks, Cindy.